First seen on April 18th, 2019. What was that you said?
So my wife said after 20 years, she's never seen my skin so clear.
This is Joe. Today's date is August 27th, 2019. Joe came to my office with psoriasis on a scale of 10, 10. Would you agree?
I agree.
It was one of the worst cases I've seen.
Head to toe.
Head to toe. And it had driven you nuts.
Yep.
And I diagnosed you as probably being toxic.
Toxic and
root canal?
Most likely a failed root canal.
Failed root canal, mercury fillings.
Yep.
And you have now gotten most of the fillings out.
Yep.
You got a couple left, so you've been through 2 or 3 sessions. The root canal is out.
Yep. New Carlson Bridge.
Mm-hmm. You did the Hubbard detox program to detoxify yourself as chemicals, which is great to remove chemicals.
Mm-hmm.
And you're also getting some ultraviolet A treatments as well. And from your dermatologist, and from between all of these, your psoriasis is gone.
Virtually, I would say I probably have 2% left. I have a spot here or there from virtual 100% coverage. So it's, in my opinion, it's all gone.
You're a happy camper.
Yeah, much happier. I wore shorts at the beach.
And your wife can't believe it.
Can't believe it. After 20 years, never seen me this clear.
And you've had dermatologists working on you for years, correct?
For years. They were ready to give me biological shots and said, you'll be perfectly happy with that for the rest of your life. And I said, no, I won't. I'm not doing that. I did steroids for about 3 weeks to get into the comfort zone, to be able to heal, and then wean myself as soon as I could.
So you've had steroids, that didn't work. You've had standard dermatology treatments, that didn't work. And then you came to us, and it's taken a few months to go through all this, but you're a changed man.
We did about 8-10 passes, some DIV.
Ozone treatments.
We did some RI. We did
rectal insufflation.
Yep. So ozone water.
Ozone water.
Ozone creams. Ear insufflation. I didn't do the GI. I'm working on that. But yes, all the ozone in every orifice there is, and that cleaned up to where my mold levels were down. We did the Great Plains lab test for environmental toxins, and I was 9 out of 12 were off the charts. So it was obvious that there was bad stuff in me. And so the Hubbard protocol with niacin did 3 weeks. The aggressive, out of the 3, I was the 2. And sweating is a good thing. And it cleared up my skin. I feel like I increased energy levels, a little bit of brain fog. My vision's had a little bit of getting worse, but I feel like it's getting better now. So I think it's all just about equilibrium and getting it.
And you went on a low lectin diet.
Low lectin, gluten-free,
right?
No alcohol. Just quit my job for a while. I'm back slowly getting into the office, so stress loads down is clutch. Absolutely.
And you told me I could post this on YouTube.
Absolutely.
Thank you.
Thank you, Dr. Rowan.
You said you'd be my poster child.
Here I am.
Thank you very, very much.
You're welcome.
I want to make one other comment. You're genetically positive for HLA-27.
Correct.
It's a genetic marker. It puts people at higher risk for arthritis, of psoriasis, of ulcerative colitis, and psoriasis itself. And here's a man now who is genetically predisposed, and you're cleaned up. So It shows that we can actually overcome genetic propensity by eliminating environmental triggers.
Environmental triggers and diet restrictions. Yep.
Thank you. Interestingly, you just told me your dermatologist is taking credit for this with the UV light. On the other hand, what had happened to your skin before you started it?
I would say before, or at the time of starting UVA treatments,
Which was about when did you start them?
About 90 days ago,
okay.
3 months. I had already been through the protocol, and so it was definitely clearing up. I would say 75% clear. And so the UVA was a good thing. It's still a good thing. I'm still doing it, but by no means was it the the Lone Ranger.
Right.
Yeah. It was a cocktail of treatments that all came together, and he was trying to take credit for the light being sort of the success, but
After the majority of it had cleared.
after
right?
it had already cleared, and he hadn't seen me for a while. But I would say that it's a good thing. I like the treatment; it feels good on my skin.
Yeah.
We all don't get enough sunlight, in my opinion, so it's been good like that. But really, the credit is due to Dr. Rowan to taking the test, learning about the protocol, and taking initiative to do it.
Thank you.